Good morning, this is David Henry. I'm Communications Manager for the City of Amarillo. As you can tell, we are doing our news conferences for COVID updates a little differently today. We're using Zoom. Fortunately, we are joined by our regular panel. We want to thank everyone for making the accommodations to join us today via Zoom. Let me go ahead and introduce who is on our panel. Amarillo Mayor Ginger Nelson, Casey Stoughton, City of Amarillo Public Health Director, Dr. Michael Lamontier, Chief Medical Officer, BSA Hospital, Dr. Scott Milton at Texas Tech University Health Sciences Center, Dr. Brian Weiss, Northwest Texas Hospital, and Foy Garza, Amarillo VA. What we're going to do first, we want everyone to go ahead and read statements, and then we will take questions from the media. We're going to start off with Amarillo Mayor Ginger Nelson.
Good morning, and I want to say thank you to all of the citizens who are participating in the All In Amarillo campaign. The show of support from people displaying something yellow on their porches or outside their homes has been overwhelming, and I've had tremendous feedback from our medical community and just the appreciation and watching our city rally behind them and the work that they're doing and the work that they're going to be required to do over the next several weeks. It has been very heartwarming, and I just want to say thank you to the public for supporting them and showing that support. Obviously, we're doing everything we can to fight this outbreak, and everyone has a role in doing that. Most importantly, your role is to stay home if you possibly can. Wash your hands often. Try not to interact with anyone outside of your home other than going to essential activities such as the grocery store or medical appointments. Let's talk for a minute about the grocery store. I have visited personally with the managers of most of our large grocery stores, our Sam's stores, Walmart, our United stores, either spoken with the regional director or the managers of those stores, because I realize we're not going to restrict people going to get food or groceries. The grocery stores are going to stay open, but they are a place where people are gathering in crowds, and large numbers of people will be in the store at any given time. So I did visit with each one of those business managers or operators about what we need to change operationally inside those stores in order to meet the physical distancing requirements that keep both their employees and their customers safe. Across the board, I found tremendous cooperation from those business leaders, and we discussed numerous strategies and why it is so important for their businesses to stay open, but yet for us to have physical distancing inside the operation of those businesses. But here's where your role comes into play. If you're a citizen or a shopper or a customer in those stores, we absolutely have to have that front of your mind as well. You have a role to play in keeping that physical distance. And really the most challenging part of it is at a checkout counter. So while they're ordering labels and things to get on the floor to show us the actual length of 6 feet and create that space, we need to be mindful of it. And we as customers who are there shopping have absolutely got to police ourselves and keep that physical distance always paramount in our minds as we're in those grocery stores doing our shopping. That's really it for my statement today.
Thank you, Mayor Nelson. Next for this with a prepared statement is Casey Stoughton, City of Amarillo Public Health Director.
Hi, since yesterday morning, an additional 22 cases of COVID-19 were reported to the Amarillo Public Health Department. This brings our case total to 33 cases in Potter and Randall counties. COVID-19 has changed our lives. Currently, the only way to stop the spread or to slow the spread of the disease is to stay home. Continue to maintain social distancing, which is at least a distance of 6 feet between yourself and others. Wash your hands regularly and often. That's the only way that we can slow the spread of this disease in our community. Amarillo always responds during times of challenges and adversity. We have overcome time and time again throughout history by pulling together to do what's necessary, and we're going to do that again with All In Amarillo. We encourage our residents to go to amarilloalerts.com to find out how they can be part of this effort. The way we stop this illness is by working together. If you have symptoms, please call your healthcare provider or you can call the Amarillo Public Health Department at 378-6300. Our drive-through testing center is operational today until 3 p.m. and through Friday from 9 a.m. until 3 p.m. each day. Please call our call center at 378-6300 and our call takers can walk you through the screening process. We've had great success with our drive-through testing center. On Friday, we tested 46 individuals. On Monday, 126. On Tuesday, 88. And today, so far, we've tested around 60 people. So we appreciate our community turning out for testing. I also want to take a moment to recognize the hard work of the Amarillo Public Health Department staff. They're working tirelessly to serve our community, and I appreciate their dedication. Amarillo can stop the spread of COVID-19 by doing what it has done so many times before, uniting behind our community to accomplish a common goal. So I really appreciate our community.
Thank you, Casey. We now go to Dr. Scott Milton, Texas State University Health Sciences Center.
Yes, thank you. As we enter the month of April, the number of cases reflects an increasing prevalence of COVID-19 in our community, as well as an increasing capacity to test. Do not be reassured that your community will be spared if it appears there are no or few cases, as this is directly correlated to the amount of testing being performed. The only remedy for everyone is to stay at home, avoid movement in the community, wash your hands frequently, avoid crowds of any kind, and practice social distancing if you have to get out. We expect our numbers to continue to increase as we move further into April. I personally do not believe that a 2-week period of shelter in place is long enough to bend the curve and minimize the impact of COVID-19 on our communities and our healthcare facilities. We will continue to keep you informed here at the Health Department and will likely have further changes in our recommendations to you as this pandemic unfolds. Thanks.
Thank you, Dr. Milton. I'll go to Dr. Michael Lamontier, Abbott St. Anthony's Hospital.
Good morning. Thank you for allowing us to join on this conference call today. I'd like to report a couple of our statistics first this morning. We currently have 18 patients under investigation in our hospital this morning. We had 2 patients that are positive for COVID-19 that are currently in-house. One of those patients is requiring intensive care. One of those patients is on a non-ICU ward. Over the past 24 hours, we've had 4 new positive cases detected, but only 2 of those are inpatients. We've tested now over about 150 cases, and of those over 150, 10 have been positive, with the recent uptick as mentioned. We are working very hard on our surge plan in an attempt to make sure that we have a good process in place for the appropriate beds, the appropriate location of those beds in our facilities for patients that come in as patients under investigation or COVID positive. We are working hard on trying to procure more equipment through our Ardent Health system and our partners locally, who have been also very supportive. I want to just make sure that we're also being clear that we have been very diligent about reviewing our scheduled procedures with our surgical staff in the setting of the governor's order to ensure that we are fully compliant with that order, but also not pushing off procedures that are going to potentially have an adverse effect on our patients. I met again with our surgical leadership this morning to discuss some of the specifics around how we're doing that and making thoughtful decisions around procedures that are being done, especially over the next month. I think it's critical, as Mayor Nelson and also Dr. Milton have communicated, that we abide by the stay-at-home order. One of our mottos here is that we will stay here at the hospital to keep you safe. Please stay at home to keep us safe. We need to keep our healthcare workers in this community able to function and work, and therefore have less risk of exposure that's unnecessary. The last thing I'll say is that I want to credit our staff who've been working very hard to be compliant with the PPE requirements and restrictions that we're attempting to abide by fully, which are the CDC guidelines and also guidelines that we're getting from our partners here in Amarillo. My discussions with Dr. Weiss and Dr. Milton in terms of what we're trying to do to have a uniform approach to how we protect our staff and how we continue to take care of our community. Thank you.
Thank you, Dr. Lemon-Tier. We're now going to go with Dr. Brian Weiss, Chief Medical Officer, Northwest Texas Healthcare System.
Hey, good morning. So as the same with Dr. Lemon-Tier, I wanted to go ahead and give an update on the status of Northwest Texas right now. So we have 5 patients in the hospital who are COVID positive. Thankfully, only one of those is requiring mechanical ventilation at the current time, and is doing okay. Now, as Dr. Lemon-Tier mentioned, we have also had a rather more busier time over the last couple of days. On Monday evening, we had 4 positive results come back, and yesterday we had 5 positive results come back. These are all patients that have come through our emergency room or one of our FEDs. Out of those 9 positives we got over the last 36 hours, 2 of them are requiring hospitalizations, but one of them is in critical care, but is not requiring mechanical ventilator. I've personally talked to all these patients who have been positive, and what's very clear is that this virus is presenting with a myriad of symptoms. Thankfully, most of them fairly minor in people, but the one thing that has been somewhat consistent amongst people is most of them complain of a significant shortness of breath as part of their presentation. And second, a lot of them do present with diarrhea. So the GI symptoms appear to be a little more predominant than we originally thought. But sometimes fever is not present. The good news is that most of these people are at home and they are doing well. But I know on Monday, Mayor Nelson and Dr. Milton had to make an incredibly difficult decision about the separation and kind of shelter-in-place order in Amarillo. And we are 100% supportive at Northwest, because it is very clear as I talk to some of these individuals that community spread is alive and well in the Amarillo area. So we must follow the orders of keeping separate if we're going to blunt this possible spread person to person has been feared in that sense. As with BSA, we are doing well in terms of our PPE. Our staff continue to be very positive, and we have enough PPE to protect our staff, to protect our providers coming in the hospital, and we continue to strictly follow WHO and CDC guidelines, along with obviously the governor's and the mayor's declarations. Just one last thing is as we really focus on COVID, we can't forget that the hospitals continue to take care of patients with multiple other issues and morbidities. And one thing in Northwest, we are a trauma center, and we continue to see people that come in need of blood. And I would like to put in a plug for the blood bank. I've talked to them recently, and they've seen a significant reduction in the amount of donations. They are open for donations, and I personally talked to them, and they are taking extensive measures to make sure that anyone that comes into the blood bank is being screened properly for any signs or symptoms consistent with COVID, and along with their staff, who they're checking every 12 hours to make sure that they're not developing signs or symptoms. So please, the blood bank is a safe place to go, and they are in need of blood to take care of patients who come in with trauma and other blood requiring problems. So thank you. That's all I have.
Thank you, Dr. Weiss. I'll turn it over to Foy Garza of the Amarillo VA.
Hi, good morning. So the Amarillo VA healthcare system had its first COVID-19 confirmed case on March 26th. The veteran is currently being treated in respiratory isolation at our hospital, and we have 6 additional veteran patients under investigation. Our team remains committed, equipped, and prepared to care for our veterans during this pandemic. I would also like to remind any veteran who is experiencing flu-like symptoms to call ahead to our call center at 806-355-9703 and press option 2. Again, that number is 806-355-9703 option 2 for clinical guidance over the phone. We're also transitioning the majority of our outpatient primary care and mental health appointments to virtual care options such as telephone clinics or VA Video Connect, which is an option in which veterans can connect with their VA provider over their smartphone, so that more veterans can remain home, abiding by the city's shelter-in-place order, while seeking care through some of these options. Additionally, all of our elective procedures have been rescheduled, and we're only pursuing emergent cases at this time. Additionally, our temporary no visitor policy continues at the Amarillo VA. No visitors will be allowed on campus to include family members nor caregivers unless they are directly assisting or caring for the patient. And moreover, children 18 years of age or younger are not allowed at any of our Amarillo VA facilities. Access to the Amarillo VA Community Living Center, which is our nursing home, and visitation to the inpatient units is no longer permitted. These units are being strictly monitored to protect patients deemed more vulnerable and at higher risk. This means no outside visitors will be permitted to see residents in these units and inpatient areas. The only exception will be in compassionate cases when veterans are in their last stages of life. Also at this time, all pharmacy prescriptions will be mailed out to veterans. The only exceptions include blood thinners, medications for infections, and short-term steroids. I also want to assure our veterans that our emergency department remains open 24/7. Our outpatient clinics and labs remain open for necessary in-person visits. This includes our clinics at Amarillo, Childress, Delhart, Clovis, and Lubbock. While this is a very stressful time for many of our veterans, I want to let you know that our Amarillo VA, we don't panic, we prepare, and our staff of over 1,000 remain ready to support you during this pandemic. I would like to say a special thank you to our Vietnam War veterans, as National Vietnam War Veterans Day was March 29th. I want you to know that you're not forgotten, and I hope that we'll be able to recognize you in a more personal way in the future when it is more safe to do so. Lastly, I want to thank the community for all your support and blessings. I'm honored to serve America's heroes with your support. And thank you to the Mayor Nelson, Casey, and Dr. Milton, and our colleagues over at Texas Tech, BSA Northwest, for being such great partners during this time of great uncertainty. I'm confident as long as we continue working together as one team, we can and we will come out of this pandemic a more resilient community. Thank you.
Thank you, Troy. I want to go ahead and open it to our panel. We have some questions that we've seen throughout the community. I'll try to direct them at one member of the panel, although they may apply to one or two or more members. Our first question more or less applies to Mayor Nelson. Kind of explain how Governor Greg Abbott's executive order works with our shelter-in-place order here. Is there any impact or any changes at all when compared to what the state has issued?
Obviously, we appreciate the governor's leadership, and he came out with an order yesterday afternoon that we're still looking at as a team, and our legal department is looking at to compare the order that we had issued that took effect on Monday night at midnight and the new guidelines that the governor's order sets out. So as we get more clarification from the governor on his categories and the categories in our order, then as we get that, we'll be able to pass that on and give that guidance to our community.
Thank you, Mayor. This will be a question for Casey Stoughton, City of Amarillo Public Health Director. You mentioned this earlier. How many tests have been completed as of today, the latest results? Generally, how long does it take for tests to come back from like the drive-through facility?
So we did talk about those numbers, especially from the drive-through. I think overall in our community, we're seeing a much higher number of tests. Yesterday, we reported over 450 tests have been done through our community. That number is still low, so we know that we have more tests that have been done in our community. We expect the tests from the drive-through, we expect results in 24 to 72 hours back from the drive-through.
Thank you, Casey. Well, this question would be for Dr. Milton, Dr. Lamentier, or Dr. Weiss. If all three of you want to participate in answering this question, feel free to do so. Kind of explain the 6 feet social distancing guideline and how is that important to preventing the spread of COVID?
Yes, I'd be glad to comment on that. So COVID is a respiratory pathogen, and therefore when it's transmitted through droplets, usually from an infected individual who is speaking or coughing or singing. It's in relatively close proximity. So 6 feet seems to be what we think is a reasonably safe distance to reduce the risk of becoming infected from someone who has been infected with COVID.
Now this question more or less relates to CDC guidelines. Should people wear masks in public to prevent the spread? even they may be unknowingly contagious or show no symptoms, should those people who fit that criteria, should they be wearing masks in public?
I can comment on that as well. I don't think that the CDC has made a formal recommendation to that effect. I know that they are actively reviewing that, and we are actively reviewing that here at the health department, and will likely make further comments on that in the future.
Thank you, Dr. Milton.
If I just comment on that too. We are somewhat broadening our use of masks in the hospital for our staff, and in particular, the isolation mask that we currently use. There is a process of extended utilization, in the sense of a person can put that on at the beginning of the day, wear it all day without taking it, without dropping it below their nose or mouth, and then discard it at the end of the day. And that's an extended use approval of that kind of mask. And I think overall, we see a lot of our staff have asked for that kind of utilization, and we feel that is a good idea in terms of, particularly people going in and out of rooms. Now that we have both positives and more patients who are still under investigation, we are allowing our staffs to utilize that appropriate isolation mask around the hospital.
Dr. Lamentier?
Yeah, I think I agree with the comments that were made. I think that it's a difficult question for those that are out in the community. Clearly, if someone's having any kind of respiratory symptoms, they should be wearing a mask, because those are the individuals that are expelling respiratory droplets. The question about asymptomatic people wearing a mask, as if that is going to be part of their own protection, is the bigger question. And I think there are pros and cons to that approach. There was a study done that showed that we had medical students in one community that were wearing masks, and the number of times they touched their face was substantially higher than those that were not wearing a mask, so the risk about self-contamination. But again, I think there are arguments that can be made both ways for asymptomatic individuals. We are also proceeding with an approach similar to what Dr. Weiss said in the facility, where we're going to probably have certain units that have a little bit greater risk of exposure outside of the rooms that are holding PUI, or as patients under investigation, or COVID positive patients, having those units be a little bit more of a protected environment where we're having folks wear masks. Again, is there data that supports that that's going to prevent transmission? Not really, but there can be arguments made both ways.
Thank you, Dr. Lamentier. This is the last question that we've seen throughout the community. I'm going to direct this at Dr. Weiss and Dr. Lamentier. At least according to numbers from the Amarillo Public Health Department, the vast majority of people who are testing positive do not require hospitalization. Is this apply nationwide, or can that be correlated to more expansive numbers nationwide?
I'll go ahead and start. I think, seriously, in my chatting with some of these folks who have tested positive, usually their first response to me saying you have a positive result is you're kidding. Because most of the time their symptoms are fairly minor. And so I think if you look at the data overall, the vast majority of people have minor to almost no symptoms with this particular virus. And some of the data I've seen recently suggests that it's really less than 20% of people require hospitalization with this particular virus, and that typically no more than about 10 to 14% become critically ill with the virus. So I think the thing to remember is, positive test is to stay calm. The vast majority of people will shake this off without too much difficulty. But we are worried about those that really have no symptoms, and are they possibly spreading this virus and really have no idea they have contracted this virus in the community. But yeah, I think overall that our experience is consistent with what is being reported nationwide.
Dr. Lamentier?
I would agree with Dr. Weiss's comments, and some of the data and the studies that most of the physicians now are really trying to voraciously read through based on what the worldwide experience has been and based on what we're seeing locally. It looks like from what I've seen and read in some of the most recent data, is that the viral load is the highest the first week of infection when symptoms begin. So clearly, if the viral load's the highest that first week, patients are building up a viral load prior to that first week of meeting the onset of symptoms. So then it brings in this question of 24 hours, or is it 48 hours prior to developing symptoms when patients have a transmissible state to have that virus be potentially infecting someone else. So there's not much doubt, I think, in most of the medical world that within that peri-infectious onset, meaning, or I should say symptom onset, the day you start to have a fever or a cough or shortness of breath or whatever your first symptom is, diarrhea, as Dr. Weiss pointed out, a third of patients have GI symptoms. Probably 24, maybe 48 hours before that, folks are contagious. And that's the tricky part of this illness. So the stay-at-home order is critical for that reason, so that we're not having unnecessary interaction with folks and potentially transmitting disease when we don't even know we are infected at that time.
Thank you, Dr. Lementier. We're going to go ahead at this time and open it up to questions from the media. We're going to go in no particular order. I will go ahead and identify the media. If when you are preparing to ask your question, if you want to direct it at one panel member, that's perfectly fine. If it's a general question for the whole panel, that's fine. Just state your name, your title, and what media organization.
Awesome.
I will do that. If you do the same, that way everybody knows who everybody is. Our first question will be Amarillo Globe News, David Gay. If you don't have any questions, that's perfectly fine, but feel free to ask. Our first is David Gay, Amarillo Globe News.
Yeah, I have a question for Casey about the addition of the test coming from creating in-house at the Texas Tech Pharmacy School. Can you tell me the impact that those tests had on the drive-through facility, and how long specifically those specific tests will take for turnaround time? Because I know they just came in through the drive-through facility yesterday.
So currently we're working with tests that are going to private labs. And so those are the tests that we're using at the drive-through facility right now. We are working with Texas Tech, and we'll use the VTM that they have made, but we're not using that right at this moment. So right now we're using testing material that we're sending to private labs.
That's it for me. Thanks.
Thank you, David. At this time, we're going to go ahead and just generally open it up to the media as a whole. Please go ahead and identify yourself and ask your question. If it's directed at one panel member, that's fine. The whole panel, that's fine. We'll just try to do it slowly and in an orderly fashion at
There
this
is no place to
go
go.
right ahead.
It's all done this way. Yeah. That's why in my office I could ask a question.
Any questions from the media at this time? Feel free to ask now.
Yes, Ariana with News Channel 10.
Go right ahead.
Okay, for Dr. Weiss, the one patient who is in critical care right now, is that the same patient on the ventilator from last week, or is this a new patient?
So this is the same patient, and this is the most elderly patient that we've seen thus far, and so she has been on the ventilator for over a week now. Again, still requiring somewhat minimal or ventilator settings in terms of the percentage of oxygen that she's requiring to keep her oxygen level normal is pretty low, but we still have not been able to wean her off the vent. I think it was interesting, if you look at some of Governor Cuomo's comments over the last week, one thing that's come up is that when a person is put on a ventilator, on average, they require a week to 2 weeks on that ventilator to get past this particular virus. So there too, our experience is very consistent in the patients that we have had to use our mechanical ventilator for. All of them have been at least 1 week on the vent before we could effectively wean them off it and take off the ventilator.
Perfect. And you probably said this, but it got a little loud in the middle. And is she continuing to get better, or is she still kind of in the middle?
Just overall, I would say that she is maintaining where she is. I was hopeful a couple of days ago that she was very close to being able to come off the vent, and she's just kind of tracking evenly right now. So not getting worse, but unfortunately just not quite where we can take the vent off at this time.
Okay, thank you.
Any other questions, Ariana?
Yes. For Mayor Nelson, so the new store requirements, could you kind of talk about that one more time? So obviously 6 feet apart when you're checking out, but will there be any kind of rule or any kind of, I know it's self-policing, but any changes we should be looking out for in the grocery store?
No, absolutely have access to go and get groceries. That's an essential activity. We're asking families that they shop in their normal course of shopping. So if your family typically buys groceries every other day financially, that's how you need to do it, then please continue in that same pattern. If you can shift to buying groceries less frequently, more groceries at one time and only sending one family member at a time to get groceries, I think that's helpful. The spirit of this is that we would try and limit the number of people that go into grocery stores, but we're not limiting our citizens' access to grocery stores. So it's a very important distinction that we need to keep in mind there. And then once we're in the grocery stores, each store is a different size. And so while we discussed using a number limit, some cities are saying no more than 100 people in any store at any time. We just felt like that was unfair to our local stores. They're just such different sizes. It's about the spacing inside the store, and we are asking them to help us operationally to create that space. And we're asking citizens who are there shopping to be mindful of it and create it for themselves. And so we'll keep an eye on that, and hopefully the conversations that we've had and the restrictions that they're putting in place will accomplish that.
Thank you, Mayor Nelson. And I have 2 more, Dave.
Go ahead.
For Casey, do we think we'll continue drive-through testing next week, or is that still kind of up in the air right now?
It will depend on the availability of supplies, but I do anticipate at least early in the week, yes.
Perfect. Thank you. And then this one, whoever can answer this question, I know that the testing through the drive-through is free, but do we know how much it costs to do a COVID test either at your primary care doctor or in the hospital, or a range?
I think we're getting $50. About $50 is the cost of the test for us.
Perfect. Thank you. That's all I have.
Thank you, Ariana. All right, I want to say this right now. If you're a member of the media, please unmute your microphone when you ask the question, and then you can mute it again afterward. I'm going to go ahead and open it up to the rest of the media. Let's do so in an orderly fashion. Just state your name, what media entity you're with, and if your question is directed at one member of the panel or the general panel, feel free to do so right now. Any questions from the media?
Yeah, this is David Gay again from the Globe News. I have a follow-up question for Mayor Nelson about the grocery store comments that she made. I know in your conversations with the different managers of the grocery stores here, is there a specific time or a specific time of day that they recommend people going to shop, just to kind of spread out the community a little bit more during this time period?
We didn't discuss specifically hours. We had internally, as a team at the city, discussed should we try and create something, some sort of framework to encourage people, families with last names starting with this letter should shop on this day, that kind of thing. Almost like when we ask people to water, odd addresses, water your lawn on this day, even on that day. But we just felt there was too much variance in the community for financially what people can do. Not everyone can afford to shop for groceries just once a week. And so we're just asking citizens to shop in their normal pattern. And I know some grocery stores have created hours for seniors. I was made aware of a need this morning for healthcare workers. Some healthcare workers don't get off work or leave the hospitals until after 10 p.m. And many of our stores are closing, shortening their hours just to limit the contact that they're having with customers. So it may be that some grocery stores want to consider one night a week that they stay open later, or 2 nights, so that our medical care community can get to the grocery store and get the supplies that they need for their family.
Understood. Thank you for the clarification. I appreciate it. That's it, Dave.
Thank you, David. Any other questions from the media? Please unmute your microphone at this time. Any other questions from the media? Going once, going twice. All right. We want to thank everybody on our panel today for joining us, making the accommodations to do so on this Zoom news conference. Once again, we will be doing this every Monday, Wednesday, and Friday with panelists as available at 11 a.m. I want to thank everyone for attending. Thank you.
Thank you.
Thank you all.
You.